Imagine what we could do if we knew where illness was spreading in our local community before it affected our friends and our families. Today we're going to show you how we're creating a real-time map of human health. We're also going to show you the product and platform that will enable it. I'm here with my colleague Nathan. My name is Inder. I'm the founder and CEO of Kinsa. Prior to starting Kinsa, I worked at the Clinton Foundation, where I led part of their international health program. I left after 5 years because I am even more excited about what we're doing here at Kinsa. So we'll tell you about that in a moment, but let me tell you the background and how we got started. So we started with the basics to create this real-time map of human health. Fever is an early indicator of illness, and so we thought to ourselves, how do we collect information on fever, and how do we communicate with people who have just learned that they have a fever? To do that, we revolutionized the world's most widely used medical device, the thermometer. This is the world's smartest thermometer. It tells you how to avoid getting ill and how to get better faster if you are. Nathan's going to demonstrate the product, and he's going to play the role of both a child and a parent. So imagine for a moment that your 5-year-old child is feeling ill. So you take out the Kinsa Smart Thermometer and you connect it to your smartphone. Nathan's using an optional extension cord here for demonstration purposes. So go ahead and get started, Nathan. Nathan's going to take his temperature, and we're going to, there we go. All right. So Nathan's starting to take his temperature. While he's taking his temperature, I'll just tell you a little bit about the thermometer. We've designed the thermometer to be thin and comfortable to use. It has minimal electronics inside, which is how we're able to do that. There are no processors, there is no LCD, there is no battery. Instead, we're leveraging the power of the smartphone to actually take the temperature. Oh, we already finished the temperature reading. So you can see here that Nathan doesn't have a temperature. He's feeling okay. But Nathan's been complaining of a sore throat. So with a few simple taps, he can track his symptoms over time and even transmit those to a doctor. Here you see Nathan's illness history. You can see the symptoms and illness and fever over time. We forgot to add one symptom, so we're going to go do that now. I wanted to just show you the really cute icons that we have for the 12 symptoms that we're currently tracking. So because Nathan probably got sick from one of the kids at his school, we're going to check the illness at his school. Here you see the first grade, the private group that you joined with other parents of Nathan's first grade class. You see that 5 out of 24 kids are ill. You don't know who they are, but you do know that strep throat is going around. And so that concerns you. So you look for the next opening at the nearest urgent care facility near you. To make sure that you have everything that you need to take care of your family, we're adding features like one-touch call nurse and this really cool illness forecasting feature that will tell you when your child is likely to be contagious, when they're not, and when they're likely to get better. And it's through these kinds of features that we're able to engage people who have just fallen ill and collect even more information anonymously. Even if you haven't joined a private group, you can still see the local health situation. Here you see it on a map. We combine our data with data from others to give you this kind of interface to see by neighborhood what the level of illness is and what's going around. Nathan's tapping on one of the neighborhoods right now to get a little bit more into detail. And in this next depiction, you'll see what I like to call the health weather. It shows you what illnesses are circulating in real time. So this is just to give you a future vision of what our product will be. Today we're launching an Indiegogo campaign. And on that Indiegogo campaign, we're looking for your support. Support will help start a movement to share the information we need to keep our families and our neighborhoods healthy. Our goal as a company is to give individuals the information they need to keep their families healthy and also enable society to track and stop the spread of illness. If we succeed, we will create a system where data saves lives. Join us on Indiegogo, and together, let's revolutionize health.
Sure. So that's pretty cool. What's your target for the Indiegogo campaign?
75,000, but in all honesty, it's much higher than that.
And so you're going to get some temperature information. How can you where do you tap into public information databases to capture those maps of illnesses?
So there's two levels. One is public data, right? So the U.S. Centers for Disease Control has some data that we can access. There's also private data partnerships that we're crafting to get both healthcare things like claims data. We started some early conversations with some people around that, and also get non-health information, behavioral information. So as a very simple example, imagine that you knew that the number of check-ins or the number of mobile blips went down in a particular school, right? You know something's going on, and when you can corroborate that data with data from us, real-time medically accurate data, you can now potentially increase the signal to noise, increase the accuracy of and understanding of what's actually happening that creates that sort of behavioral change.
And what's your target price point for the thermometer?
So because there's minimal electronics inside, we're actually able to keep our costs very low. So at launch, we'll price it comparable to premium thermometers that you find on the shelf. Once we achieve a certain level of volume, that price point will drop significantly. Yeah.
So as a mom in an area of high technology adoption, I can see this being something exciting, particularly because the visualization is so simple. But I guess my questions are around defensibility. Because there's a lot of simplicity built in, it's a lot, it's heavy on the UI. How do you make sure that you stay ahead of any competition?
Move fast. There's actually
I like that answer.
I think that is actually one of the big answers is that we're trying to move very, very quickly. You'd be surprised at how hard it is to create an FDA approvable a product that connects through a headphone jack and has that level of accuracy and safety.
So you're already approved?
We are not already approved, so we will be releasing a product once it's cleared this year, but we have tested it, and we finally meet the levels of accuracy and safety. In fact, we exceed them by a pretty significant margin.
And when do you think that you'll be able to hit that? I mean, do you have a fair level of confidence that it will hit?
Yes, again, the testing's been done. It's a matter of just manufacturing the product and giving samples and submitting. So this is a Class 2 medical device, 91-day, 20-day approvals. There's a lot of guidance on thermometers, and there's a number of data points that suggest that the FDA is approving smartphone-connected medical products even faster than those timeframes.
And then related to fever, it seems like with all of the different things that could be going wrong, particularly with children, the fever is only one component. As you do your studies, how central is temperature to helping you identify what's going on?
Yeah, so it gives us the level of illness, right? That's a first indicator. Just what is the level of illness, high or low? Symptoms give us more nuanced data. Beyond that, that illness forecasting feature gives parents information around 8 of the most common illnesses. When you engage with that feature, which we haven't shown you here, we actually are able to collect a little bit of information on the illness itself. And that's the kind of thing that's going to push us to the point of being able to truly map in a very nuanced way health. But again, it starts with just understanding whether the level of illness is high or low in the local area.
Okay. A lot more questions. You can meet Kinsa at the booth in the pavilion. Let's give a big round of applause for Kinsa.